I'm Dr. Neil Bowen, the Director of the Behavioral Health Services Division for the state of New Mexico. We are in the midst of a crisis in the state in which we don't have enough providers. The providers don't really look like New Mexico, and we don't have providers who are trained in the ways that we need them to be trained. And peers help us with all of those aspects. So developing the peer workforce is a critical part of developing the overall workforce in behavioral health in the state of New Mexico. One of the things that we have succeeded in the Behavioral Health Services Division is we've made most, if not all, of the activities that peers engage in are billable to our Medicaid system, which gives a significant financial boost to providers. And so should be an incentive for providers to make it their policy to hire certified peer support specialists whenever possible.
Just don't forget where you came from. Just because you have 2 years, 3 years, 10 years, whatever, this is something I could do because I've been there and I've done it. I've lived the life. So I would let employers know, like, hey, we've been there, we've done it. So, give us that chance, I would love to continue this. So I really do hope I could continue working with Judge Lydiard a lot longer, and other judges. I hope other judges jump on board with what Judge Lydiard's doing. Try something different, it doesn't hurt to try something different.
Peer support workers have a ability to connect with individuals involved in the criminal justice system who are suffering from substance use disorders in a way that is unprecedented and cannot be compared to any other individual that I have seen working in the criminal justice field. People who I've never even spoke to about my peer support workers will ask me during their sentencing, "Judge, can I have a peer support worker assigned to me?" Actually, they know my peer support worker's name, and his name is Sixto, and they'll ask me, without ever even me bringing it up, "Judge, can I report to Sixto? Can he work with me?" And for me, I don't need to see a statistic or a data point to prove, after seeing that happen, that there's benefits to having peer support workers work with individuals in the criminal justice system.
So I'm a case manager at the Espanola Pathway Shelter. I'm also a CPSW. My job is to, assist the homeless community, or anybody really who struggles with addiction. I didn't start out as a case manager. I was just another employee. I know that what I do is impacting people's lives.
At Espanola Pathway Shelter, we have one certified peer support worker with us, and that's Ronnie Flores, and he is phenomenal. We are so grateful to have him. And his role started out as a shelter support staff, and he was working evening shifts and overnight shifts, helping out with our homeless folks that were coming into our warming center at the time. And then as time went on, we started seeing that he had more abilities, and his talents really weren't being used to their full potential. So we promoted him. He's only been with us for about 5 months, but we saw very quickly that what he was doing was actual case management. So now Ronnie is our case manager. And as a peer support worker, the value that he brings has been very instrumental to helping our folks get to that next level. So he has been sharing his story with people, and what is so incredible about that is how that breaks down people's barriers. It breaks down their defenses. It builds trust so fast because people see that, wow, he's one of us. And if he can do it, I can do it. And wow, he was scared, and I'm scared, but he came out of it, and he's just such a great role model and a mentor in a position that is very, very valuable to our organization. So it's just the benefits are seen with each and every individual that he works with.
As far as peer support work, I love what I do. I love what I do. I wake up every morning and say, okay, who am I going to help today?
A recovering addict, they fall 2, 3, 4 times. And there's a lot of times that, they give up after the 3rd or 4th time. They say, you know what, I've been to inpatient. I've been to outpatient over and over again. It doesn't work for me. It doesn't work for me. But if you ask any of your CPSWs that were addicts, they'll tell you themselves, sometimes it took 10, sometimes it took more, but you will get to that point, and they're such a great encouragement.
The CPSW plays such an important role at all levels, not just in advocacy, but inside the treatment program too, where I work. We have 3 CPSWs in our treatment program, right? And they do so much work, man. It's unbelievable.
But I take a lot of pride in everything that I've gone through as a peer, and I've seen people's lives turn around just by me saying, hey man, I know what you mean. I had similar situations, but if I can do it, so can you. And I've seen people's lives turn around. I think most importantly, we're here to show them that it can be done.
My name is Montano. I am the program manager for the Office of Peer Recovery and Engagement for the state of New Mexico. I'm a CPSW. I'm a woman in long-term recovery, and I'm very proud and honored to work for the state of New Mexico on BHSD.
The peers have become a really critical part of the behavioral health care system throughout the state of New Mexico. And I look forward to continuing to expand their role in delivering the kind of healthcare, the kind of integrated behavioral and primary healthcare that all of our neighbors in the state of New Mexico deserve.